Awesome. Well, happy Friday, everyone. Thanks for those who are joining us. For folks who don't know me, I'm Matt Martin, and I serve as the Associate Director at NCAA's Action Network. And today is Overdose Awareness Day. That's the last day of a long week of Overdose Awareness Week. And so we're here to talk about overdose prevention here in North Carolina and kind of what's going on in the policy space and when it comes to harm reduction. We're really excited to be joined by Dr. Elyse Powell, who's the Executive Director of the North Carolina Harm Reduction Coalition. So I will give you a second just to introduce yourself, and then we can kind of get rolling from there.
Sure. So, you gave most of it. I am the Executive Director of the North Carolina Harm Reduction Coalition. We are North Carolina's only statewide harm reduction organization. We run a number of SSPs, syringe service programs across the state, as well as do advocacy for people who use drugs.
Excellent. Cool. So the majority of folks who are probably watching on our page are HIV advocates. And I think that we know the term harm reduction. We hear it a lot. We know that it's important. And when we talk about our policy priorities, we're always talking about harm reduction. But can you kind of give us a little bit more of a breakdown for folks who have heard the term but don't really know what exactly it means to be in harm reduction?
Honestly, such a good question, because harm reduction holds a lot of different things. So I tend to break it down into two buckets. There is little h harm reduction, which is the public health practice of trying to reduce the harms associated with drug use. So that often looks like making sure people have clean supplies so that they don't spread infectious diseases, making sure that they have appropriate wound care, making sure they have naloxone kits to prevent overdoses, providing test strips and drug checking is a big part of it, and all of the wraparound support. So what a lot of people don't realize about harm reduction is it isn't just the supplies. It's building a trusted relationship with the people we serve to start a conversation about their health, to say, hey, I noticed that wound on your skin's not looking so great. Can we talk about it? Can I get you, do you want to connect to care? Or we have a number of programs where someone will sort of say, hey, I need help finding housing, food, whatever it is, and we will do everything we can to connect to care. So that's little h harm reduction. Mm-hmm. There's also what I think of as capital H harm reduction, which is really acknowledging that harm reduction fundamentally is a social justice movement that advocates for the dignity, autonomy, and health of people who use drugs and seeks to challenge and transform the systems that marginalize them. So we have both this very on-the-ground public health component, but we can't do that without acknowledging the broader systemic context that we operate in.
Yeah, absolutely. So just to kind of like reiterate what I think I heard you say. So little h harm reduction is like the holistic kind of health that we're helping folks who use drugs to access all of the services they need to keep themselves safe, keep themselves out of harm in the safest way possible. Mm-hmm. And then the big H is the systemic problems that we see, where we've got a system who has criminalized drug use for years and years and years and keeps people out of care. And so the big H is working on those systems to break them down and make it a safer and more approachable world for people who use drugs.
That's exactly right. And I'd be remiss if I didn't acknowledge that both pieces of harm reduction have extremely deep roots in history in HIV advocacy and response. And so, we owe a lot of our work to the incredible work that you and your team and the HIV advocates around the country have been doing for many, 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 many decades.
Yeah, hand in hand, intersectionalism, we are stronger together, so we got to keep fighting this fight together.
Exactly right.
Okay, so as a policy organization, we really want to think through like how we advance policy that are going to help folks who are using drugs. I know one of the things when we talk about overdoses that has been really prevalent for our organization, I know y'all's as well, is the Good Samaritan Law. So can we talk briefly about what the Good Samaritan Law is meant to do here in North Carolina, and then what our policymakers can do to make our Good Samaritan Law here in North Carolina better and more beneficial for people who are using drugs?
For sure. The top line answer is what Good Samaritan laws are supposed to do is make people feel safe enough to call 911 in case of an emergency. That is what a Good Samaritan law is supposed to do. All 50 states have some version of a Good Samaritan law, but the idea is you should be able to tell people look, I understand that you're scared. You may have been using drugs that are criminalized. There's a number of Good Samaritan laws where there were issues with underage drinkers, right? And, we should be able to tell people, even if you were doing something, right, that may be against the law, call 911, and you should have enough protections to make you feel safe calling 911. That is what a Good Samaritan law is supposed to do. And, to go into the other part of your question, which is, what does our law do now and what can we do better? Our law in North Carolina is fairly limited compared to a wide number of other states, right? So, for example, our law protects against prosecution, but doesn't protect against arrest, which is crazy to me, to say, okay, we want you to call 911 if your friend might be experiencing an overdose, or, if you're underage and you're drinking, but we're still going to arrest you, but we can't prosecute you, right? Like, that just doesn't make sense to me.
Yeah.
And makes it really hard to communicate. So, prior to joining the Harm Reduction Coalition, I was at state DHHS for a number of years. And one of my jobs was to try and communicate this policy. And, it's so narrow in North Carolina that it's actually hard to communicate around, because we sort of have to say, okay, well, you can call, and you'll only be protected from prosecution, but not arrest, and only if you had less than a certain amount of this. And also, it doesn't cover campus security protection, right? So it covers 911 calls, but if you're on a college campus and call campus security, you're not protected. It doesn't cover if you're at the city, there's 3 of you or 4 of you. One person who picks up the phone just happens to be the one quickest to the phone. Your friends there aren't protected, right? Which can lead to, really unfortunate dynamics. So yeah, our current North Carolina law is fairly limited, and we definitely need to grow into some changes to be able to make it just achieve its stated purpose.
Right, because the whole purpose of these laws is that if someone on the scene is in need of medical care, they should be able to get that medical care. But what's happening is people are afraid to call. Their friends may be experiencing an overdose, and it's like, I could call, but also I don't want to go to prison. So they leave people who are in really dire circumstances, and then they don't get the access to care that they need. And then ultimately, a lot of times, unfortunately, we hear stories over and over again of people passing away because they're not able to, because their friends are scared in those situations.
That's exactly right. And, I know there are many parents out there who have lost kids to exactly that scenario, right? Someone was afraid to call and a life was lost that didn't need to be. I thought it was so interesting. Big shout out to the Expand Good Sam North Carolina Coalition. Lee Storrow and Randy Abbott are doing incredible work on this. And they actually fielded a poll just to get public opinion on what matters to folks. And one of the most interesting things to me was people came back overwhelmingly saying, we care more about someone being able to call 911 than we do about pursuing a criminal response, right? The 911 call is more important than the arrest. So if we've got to prioritize these 2 things, and that's such common sense, right? Of course we want, if our goal is to protect people, saving the life is the thing that should be most important.
Yeah, 100%. 100%. So I think one of the things that folks can do, of course, we want to do this expanding the Good Samaritan law so that folks are getting the access to care that they need. We're also talking about folks being able to carry around naloxone or Narcan or some kind of overdose reversal. Can you give us just kind of a bird's eye view of what those are and kind of like how folks can utilize those services?
Sure. So do you want me to give just an explanation of like what naloxone is, or more?
Yeah.
Sure.
Just to make sure that folks understand. Yeah.
Totally. I'm a giant dork about this, so always happy to give an explainer. So naloxone is an opioid overdose reversal agent. It is a drug you can administer to reverse an overdose. It comes in a few different formulations. The one people are probably most familiar with is Narcan, which is the little, it looks like a little Flonase applicator. It's in a little nasal spray bottle. There's also intramuscular naloxone, right? That's what we tend to distribute at our syringe service program sites, which is a little vial. It has a little syringe. You can administer it right there. So lots of different types of, and then there's many different brands and flavors within there. Lots of different types of naloxone. I think everyone should be carrying naloxone. I want to see it everywhere and for everyone. And so it's fairly easy to access naloxone now. There's been a couple of key changes in our state. So for example, naloxone is now over the counter. So you don't need a prescription for it anymore. So if you want a kit for yourself, it's fairly easy to pick one up from a pharmacy. If for folks who are serving people who are at higher risk of an overdose, highly recommend connecting them with their local harm reduction program. Nearly all of them in the state give it out for free. We actually operate a mail-based naloxone program. So this is specifically for people who use drugs or people recently exiting incarceration or the people who live with them. But we will mail them a intramuscular kit for free. Last year, we mailed kits to 85 of North Carolina's 100 counties. So there's also lots of partners. There's state DHHS does a great job getting naloxone out there. Your friendly local health department may stock it and have it for community-based organizations. Always a shout out to our local health departments and treatment providers. Many do stock naloxone. So lots of different ways to get it.
Perfect. And so kind of diving into the policy, and this is a little bit outside of policy sphere, but I think it's something that we who are working in this movement have heard a lot about, is high dose naloxone. And there's a lot of controversy about that. So would you be able to kind of give us a little bit of a taste of what you're seeing when it comes to high dose naloxone?
For sure. So just for the uninitiated into this debate, a standard naloxone, what you tend to get, particularly for the nasal, is a 4 milligram dose. What we're seeing in these high dose is double that, an 8 milligram dose. And what it's being sold under is the logic of, there's a lot more fentanyl out there, drugs are more potent, and therefore we need stronger doses of naloxone. And that has been what the pharmaceutical companies who sell these products are pushing. But what the science is coming back and telling us is that's actually not true, and there's some risks involved. So there's a great compassionate overdose summit that really summed up the research nicely. But CDC, a number of research partners have published studies finding that you do not need more naloxone to successfully reverse an overdose. Combination of naloxone and rescue breathing, right? Standard overdose response protocol. Even with the drugs that we're seeing on out there today, reverses it just fine. And there's some harms, right? So these much higher doses of naloxone can actually precipitate withdrawal and precipitate much larger withdrawal symptoms in the folks who it's administered again, which first of all, just makes the person feel incredibly sick. And then you don't want to make that person reticent to call for help again, right? If they, for what unfortunately have to receive naloxone and get really sick from it, is that going to make them pause before they call for help a second time? Right? Like these things do matter. And given that we have ample 4 milligram dose, I also want to give a shout out to the Revive product. Remedy Alliance actually put out a 3 milligram dose, which we really love to see. Still is just as effective, much more compassionate response. Final point, because I know that there are a lot of folks who have fairly restricted money. The higher dose is a lot more expensive, right? And if we're in the business of getting as many kits out there to as many people who need it as possible, why would I spend 3-4 times the amount on a kit that I know is ultimately going to cause harm?
Yeah, absolutely. And I think kind of going back to the survey that we did, it is very apparent that overdose and folks who have experienced overdose and their families is a really large number of people in North Carolina. It impacts the majority of North Carolinians. They either are someone who has experienced an overdose or knows someone in their family or their close friends who have experienced an overdose. So access to naloxone is so important. And I think more people should just keep it with them just in case. You never know. It could be a family member. It could be a friend. It could be somebody who you're passing by in the gas station who all of a sudden goes into an overdose. So having access to these services and being able to be like, hey, I've got it in my bag. I can help you if it needs to be. It's just like, it just makes common sense. It's something that is so powerful and has the ability to save lives and is so easy to administer that like more people should be keeping these in their bags.
Oh, for sure. I totally agree. And, one thing I also tell people is it also helps reduce the stigma, which is so important, right? To sort of say, yes, naloxone is part of our daily life, right? It is out there. We have it on us. I have some in my medicine cabinet, right? Like, sort of starts a conversation. Oh, what is that? What's that for? Oh, this is naloxone. This is what it's used for. I have some extra if you'd like to carry some, right? It helps start that conversation about in a non-judgmental way to say, you know what, there's no shame in experiencing an overdose. We're not going to shame people who use drugs, right? We're just going to be there to support them and protect each other.
Yeah, 100%. So in thinking through kind of where we are when it comes to overdoses in North Carolina, I know that when we were kind of preparing for this, one of the things that you mentioned is there's been some reports that we've seen a decrease in overdoses. However, that's not the full picture of what's really happening. And it's not the case for every community in North Carolina. So can you talk a little bit more about kind of what we're seeing when it comes to trends here in North Carolina and the folks it's most impacting?
For sure. So how our state often tracks both fatal and non-fatal overdoses is basically looking at like year to date, right? So, okay, it is now the end of August. So how many fatal and non-fatal overdoses have we seen compared to August 30th of last year, right? So how far are we into the year? And what that data is looking like is that we are on track to see a decline. And as you said, like not every community is seeing that. So in particular, our Black communities and our Indigenous communities have disproportionately high overdose rates. We are not putting enough services that specifically serve those communities, right? We need to make sure we have culturally competent and non-judgmental services and just basic access to care, right? These are communities who have been long underserved with basically every health epidemic that has come through North Carolina. This one is no different. And so I am a little worried that folks are going to look at the data. They're going to take their eye off the ball. They're going to say, yep, like we've got it. Overdoses are going down, rah, 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 and leave behind the communities who are most impacted by this. I will also note, while we are seeing a decline, we're not even down to our pre-pandemic levels, which was an all-time high from before the pandemic. I remember in 2019, we were starting to see a little bit of a decline. We were thinking, okay, maybe this is going down. And then of course, COVID hit and numbers surged faster than we've ever seen them. So also caution people to not count their chickens before they hatch.
Yeah. And I mean, I think like you mentioned, this is something that we see in disease state across the board and health outcomes across the board. It's like we see improvement, but we don't really take a deeper dive into like where we're seeing the improvement. And if it's only benefiting those who have the most access, we can't celebrate that. And we got to really dig into like, okay, where is this happening? Where are we seeing changes? Where are we not seeing changes? Where are we seeing changes for the worse? And we really need to focus on making sure that those who are most impacted really have the access.
That's exactly right. We were just in Wake County yesterday for an event, and Wake County has seen a 200% increase in overdoses among their Black residents, right? So the numbers are not pointing in a good sign overall. So I totally agree.
Yeah. So I know we've talked about a lot of different topics when it comes to harm reduction and overdose prevention. Did want to kind of give a chance if there's any kind of call for action that you may have. So like what can advocates do in regard to harm reduction and overdose prevention policy?
For sure. So a couple of different things. One, go find your friendly local harm reduction organization. We need you. We love you guys. We promise we're not strangers. We're always looking for volunteers, opportunities to collaborate. I'm sure many of your folks have lots to teach us, right? So North Carolina is lucky to have 47 syringe service programs operating across the state. Go find your local one and make sure you know how to refer people to it, know what programs they've got going on. Also just being vocal in support of harm reduction. Just like HIV, just like overdose, stigma is a major killer. It is a major killer. And so the more we can say, this is what we want and this is what works, and we're not afraid to use the word harm reduction, and we're not afraid to use the word syringe service program, and we're not afraid to talk about this, and I think helps us out a ton. And then finally, advocating, and I think this is something that HIV advocates have been incredible at, and harm reduction has learned a lot from y'all, is really making sure there are folks with lived experience in decision-making capacity. So I'll take, for example, we know that counties are currently in the process of spending their opioid settlement dollars, right? We want to make sure that the people who were impacted by this epidemic are able to have a full decision-making capacity in how these funds are spent, right? We know, I'm glad the opioid settlement dollars are out there, but fundamentally it is blood money, right? Yep. This was money that was made off of the people we serve. And so, I don't want to just see people having one town hall, right? People with lived experience should be in there in the rooms. And so if you're involved in your community, if you're involved in your county's work, whether it's opioid settlement dollars or other work, in harm reduction, we have a phrase, nothing about us without us. Making sure there's that representation in the room is just so important. And of course, all of the policy, call your representative and talk about how you want Good Sam expanded, talk about how you want better protection for harm reduction. Short list.
Yeah, just a few little things.
Yeah.
Well, Elyse, this has been incredible, and I think it's a great start for a lot of HIV advocates who feel like they have heard harm reduction but don't really know what it means and how we can really kind of amp up what we're doing to work across our various organizations. How can folks find information about NC harm reduction and what y'all are up to?
Sure. So you can always find us at nchrc.org. We are active on all the various social media platforms. We even set up a TikTok account. I don't want to tell you what. Very, very grateful for my more social media literate teammates who are able to do that. But at NCHRC across all the different platforms. So come find us, and we'd love to hear from all of you.
Awesome. Well, thank you to the folks who have joined us and listened in. Hopefully you learned something today. Elyse, this was great. We appreciate it so much. Happy Overdose Prevention Day to everyone. Let's all carry naloxone and save some lives.
That's right. Thank you so much. And thank you to everyone.
Thanks, y'all. Have a good one.